Tiotropium is a long-acting muscarinic antagonist with an onset of 30 minutes and a duration of more than 24 hours. It antagonizes the cholinergic effects of acetylcholine, resulting in bronchial smooth muscle relaxation and reduction of secretions, thereby increasing airflow and dilating airways. As an antimuscarinic, tiotropium can cause mydriasis, tachycardia, flushing, delirium, hyperthermia, dry skin, and urinary retention. It can also cause paradoxical bronchospasm and anaphylaxis like indacaterol. This drug is contraindicated in patients with hypersensitivity to atropine or its derivatives. Also, it must be used with caution in breastfeeding women and patients with angle closure glaucoma, prostatic hyperplasia, and bladder neck obstruction. Avoid using together with other anticholinergics which may cause an additive effect, increasing the risk of adverse reactions. Fluticasone is indicated as a maintenance therapy for severe airflow obstruction in patients with COPD. It is only used as an adjunct because of its lower efficacy and due to its associated risk of developing bacterial pneumonia. It is an inhaled corticosteroid with a potent anti-inflammatory and vasoconstrictive activity, thereby making it a powerful prophylaxis of COPD exacerbations. Its onset is in 12 hours and a duration of 1 to 2 weeks. Like all other corticosteroids, fluticasone's significant adverse effects include adrenal suppression, immunosuppression, pneumonia, oropharyngeal candidiasis, and nasal perforation. Prolonged use can also predispose women to increased osteoporosis risk and arthralgia. Fluticasone is contraindicated in patients with hypersensitivity to it or its components. It is also not intended as treatment in acute asthma and status asthmaticus. Furthermore, use this with caution in patients with tuberculosis and any kind of pulmonary infections. Fluticasone may increase risk of systemic exposure and side effects with CYP3A4 inhibitors like ritonavir, cobicistat, and ketoconazole. Use with caution together with loop diuretics as they may cause hypokalemia and ECG changes. Proflumidas is used in people with severe COPD to reduce the number of episodes or worsening of symptoms. It is a non-steroid anti-inflammatory used in COPD. It is stated to significantly improve lung function and works by decreasing swelling in the lungs. It is not a bronchodilator and it will not treat a bronchospasm attack that has already begun. It serves as a maintenance therapy for long-term effects. Adverse effects include decreased weight and appetite, insomnia, headache, diarrhea, nausea, and abdominal pain. Proflumidas is contraindicated in patients with hypersensitivity to it and to those who have a moderate to severe hepatic impairment. It can increase exposure and persistent intolerability with drugs like enoxacin, cimetidine, and fluvoxamine. When used together with phenobarbital, carbamazepine, or phenytoin, it may suffer from reduced therapeutic efficacy. Increased inhibitory activity when taken with erythromycin, theophylline, and ketoconazole may occur.